Hello, dear friends and colleagues. Today, I'd like to talk about another hot topic which is very important in exam, in part 1, part 2, and basis exam. It is hereditary hemorrhagic telangiectasia. Another name of this disease is OSLER-WEBER-RENDU syndrome. OSLER-WEBER-RENDU syndrome. Okay. So again, I'd like to analyze the name so that you can easily understand the disease. Hereditary. Hereditary means family, the running in the family. This is genetic disease and it's run in the family. Okay. So run in the family. So in general, just you remember, if any prefix like hereditary or like familial, you have to think that this patient is having autosomal dominant inheritance. There are few exceptions like familial Mediterranean fever. It is familial routine, but it is autosomal recessive. But most of cases, if there is familial or hereditary prefix, you just think that it is a autosomal dominant. So it is autosomal dominant condition. That means 50% of the generous children of affected person, if another partner is normal, will be affected. So 50% autosomal dominant, 50% affected. But in exam, there will be some trick. Patient may present with hereditary hemorrhagic telangiectasia. The symptoms of hereditary hemorrhagic telangiectasia, and may ask what is the inheritance. So it is autosomal dominant. But sometimes patient may say that my father is having hereditary hemorrhagic telangiectasia, my brother is having this disease, but I'd like to go for marriage with another person who doesn't have any disease. So is there any chance of my child or kids to be affected? Here is a trick, that patient didn't say that she is having any symptoms or she is having disease. So brother affected, father affected, and she didn't say that she is having. So the answer will be 0%, because that another partner is healthy, she is also healthy, because she doesn't mention. If she mentioned that I am having this problem like epistaxis or other things, the symptoms, then your answer will be 50%. So just remember the trick. Now, hemorrhagic telangiectasia, that means the telangiectasia which may lead to hemorrhage. What is telangiectasia? Telangiectasia is a dilatation of the blood vessel, abnormal dilatation of the blood vessel. It is due to fibrovascular dysplasia. Okay. So due to fibrovascular dysplasia, there is a dysplasia, there will be dilatations of the artery or vein, and that may lead to telangiectasia. That is you can see this blood vessel under the skin and mucocutaneous area. So what are the affected area? Lip, tongue, nose, face, finger, and skin of the chest. So you will see the red color spider-like blood vessel. This is telangiectasia. So in the name it is mentioned that there will be telangiectasia and there will be hemorrhage. Hemorrhage due to fibrovascular abnormality which lead to fragile blood vessel, which cause this bleeding. So all the manifestations will be due to bleeding. So another thing, actually there will be this arteriovenous malformations in different organs in the body. So we will get arteriovenous malformation, and due to arteriovenous malformation there will be some symptoms, and also there will be hemorrhage. So let us see where you will find arteriovenous malformation. Most common site is GI, lungs, liver, brain, sometimes in pancreas, and sometimes in the retina. Okay. So let us see individually what will happen. I said that there is a problem in the telangiectasia, so we'll find telangiectasia. Already I mentioned which place we'll get the telangiectasia, and there will be hemorrhage. So epistaxis is the most common presentations of this disease. Okay. So recurrent epistaxis will be there. So if there is epistaxis, there will be blood loss. Daily epistaxis can cause blood loss, and this blood loss can cause anemia. Which type of anemia? There will be iron deficiency anemia. So microcytic hypochromic anemia will get. So patient will not come with this anemia, may come with failure, fatigue, dizziness, palpitation. This type of symptoms of anemia patient will have, and they will present like that. Then come to the GI tract. So GI tract, there will be also bleeding. So GI tract bleeding means hematemesis and melena. Hematemesis and melena also lead to iron deficiency anemia, and patient will present with fatigue and sign symptoms of anemia. So this is the most common presentations of the hereditary hemorrhagic telangiectasia. Now, if there is malformation, for example in the lung, it is very common arteriovenous malformation. So arteriovenous malformation, what will happen? Artery will there will be some capillary and arterioles and venules. So artery will not in the capillaries. It will bypass, and there will be malformation with artery with vein. So there will be bypass of the arteriovenous system. If there is bypass, so capillary is not getting the blood, so there will be absent of effective gaseous sections, because in alveoli there is capillary, but there is malformations between artery and vein. It is not going to capillary, up to capillary, so there will be no gaseous sections. Patient will develop cyanosis. So if patient develops cyanosis, which may lead to clogging. So in case of lung involvement, we will get clogging, cyanosis, and I said that there is a chance of bleeding. It is a disease name cause, there is hemorrhage, so there will be hemorrhage. So patient will have hemoptysis. Okay. So if there is hemoptysis, patient will have cough, and as there is less gaseous section, patient will have dyspnea, difficulty in breathing and dyspnea. And as there is a malformation, sometimes paradoxical embolus can cause the stroke. So in case of lung involvement, you will get hemoptysis, cough, cyanosis, clogging, and paradoxical emboli. Let's come to brain. Again, the artery is fragile, so there is chance of hemorrhage. If there is hemorrhage in the brain, that means stroke. Patient may get stroke. So if there is stroke, according to the involvement, there will be focal sign. So there will be weakness and upper motor type of neural lesions in the limb or any involved part. So sign symptoms of stroke will get. Second thing, there is fragile blood vessel. So subarachnoid hemorrhage can be there. How will present? In my headache lecture, you will see the subarachnoid hemorrhage is present with sudden onset, severe headache, which is thunderclap type, So patient is having this type of headache and patient will have seizure. Come to liver. There is arteriovenous malformation which lead to damage of the liver parenchyma, may lead to cirrhosis of the liver and complication of cirrhosis of the liver. Portal hypertension may lead to ascites, variceal, esophageal varix, which may lead to again bleeding from the gastrointestinal tract, leading to the anemia and consequence of hepatic cirrhosis can cause hepatic encephalopathy. Okay, if involved in the retina, retinal detachment can be there, so visual problem can be there. Okay, so now we'll already discuss about all the involvement and all the symptoms and mechanism and pathophysiology which actually can be explained from the name of the disease. Now, how will diagnose this patient? Okay, genetic analysis, diagnosis, you can get mutation. There are 5 mutation, not necessary to remember. You will get genetic mutation, but genetic analysis not available everywhere, so you have to diagnose this patient. There are some criteria. One person, Curacao, not necessary to remember this name also, discuss some criteria, 4 criteria. So already we discussed about the 4 criteria. Let us discuss 4 criteria together. One criteria is epistaxis, already I mentioned. Second criteria is telangiectasia. So various telangiectasia present in the lip, tongue, nose, face, finger. So this is second criteria. Third criteria, arteriovenous malformation in the liver, in the GI tract, in the lung, in the brain. Fourth criteria, there will be history of, there is a definite diagnosis of first degree relative of having hereditary hemorrhagic telangiectasia. These 4 criteria. If any person is having 3 criteria, definitely that person is having hereditary hemorrhagic telangiectasia. If 2, there is a possibility, chance, but if 1, definitely you can say this patient is not having hereditary hemorrhagic telangiectasia. Okay. So for diagnosis we'll do the criteria and genetic analysis. But dear friend, we already discussed the complications of this disease and involvement of different parts. So how will diagnose that part? For example, lung involvement. How will diagnose that there is arteriovenous malformation? If you put stethoscope, if there is arteriovenous malformation, you will get some humming murmur. So there is a special test, bubble study, which can detect the turbulent flow of arteriovenous malformation. This is a special actually type of echocardiogram. So by bubble study, if you find that there is turbulence or arteriovenous malformation, then you can go CT angiography. Okay. Now come to GI tract. By endoscopy you can see the telangiectasia. Come to liver. By ultrasonography, that Doppler ultrasonography, you can get whether there is any arteriovenous malformation or not. In the brain, MRA, magnetic resonance angiography, you can get that one, or CT angiography. So the different part of involvement we can diagnose by different way, but generally we need CBC also and iron study. In CBC we'll find anemia, iron deficiency anemia, microcytic anemia, and iron will be less. Now come to the management. There is no cure of this disease. Most of the patient actually present with the symptoms of anemia. So correction of anemia is the mainstay of treatment. If patient is having severe anemia, blood transfusion, otherwise intravenous iron supplementation is necessary. Other general treatment, some evidence are there that estrogen therapy can be also beneficial. Estrogen cause hyperplasia of the blood vessel and can cause stopping blood, but there are some side effects. And anti-estrogen also, the raloxifene and tamoxifen can also be beneficial. Other, if there is severe bleeding, then tranexamic acid can be used. Another very important in the treatment of the hereditary hemorrhagic telangiectasia is anti vascular endothelial growth factor antibody, that is bevacizumab. Just remember this, bevacizumab is beneficial for this. Okay, now this is the general management. Now we need some specific management also. For example, epistaxis, how will manage? You just put your finger and press the nose to stop the bleeding. Epistaxis, general measurement, but not response. Then what will do? Tranexamic acid already mentioned. Not response. What will do? Cauterization can be done. Laser ablation can be done. Still there will be recurrent. Then what will do? We can take some skin from the thigh, and skin grafting can be also beneficial. If not response, then flapping of the skin can close that area of bleeding by grafting, which is in the extreme case. Okay. If lung involvement, what will do? There is arteriovenous malformation. So in lung involvement, there will be embolization. How? There is metallic coil put in the arteriovenous malformation, the detachable metallic coil that can cause embolization of the arteriovenous malformation. Okay. If liver involved, cirrhosis developed, there is no treatment except liver transplantation. Before that, embolization can be also done. In the GI tract involvement, cauterization by endoscopic, that is argon plasma coagulation can be done. Just remember, argon plasma coagulation. Okay. In brain, again embolization, and stereotactic radiation therapy can be also available. Stereotactic radiation means in different direction the specific area of the malformation can be given radiation which will destroy the area of malformation. These are the treatment. So I think this is all. So patient in exam, it may come whether it is autosomal dominant or recessive. If autosomal dominant, how will affect the next generation? What will be the treatment of bleeding in different organ? Already I mentioned. Hopefully we will get question from here, and your conception will be, I think, already cleared. And I'll be coming with another hot topic in my next video. Just subscribe my channel to stay with me. Thank you very much.